Welcome to our latest episode of Wellbeing Wednesdays, the National Council's virtual series on healthcare. In this episode, National Council for Mental Wellbeing Vice President Phil Rutherford is joined by co-founder of the Global Deflection and Pre-Arrest Diversion Movement, Jack Charlier. In our new episode, Jack will share insights into the growth and development of the global field of deflection, its role in the substance use continuum, and its impact on recidivism and recovery. Now, please welcome Phil Rutherford.
Well, hello and welcome, everyone. Thanks for joining us. Most of us know that substance use disorders represent a pretty big problem in the United States. We also know that treatment works and recovery happens. But not everybody seeks treatment options. And even those who seek treatment may not get the treatment that they need. So imagine you're in need of treatment, you want treatment, but you're in a correctional facility. People involved with the criminal legal system face a lot more barriers than most. While there's some good programs that provide substance use treatment for those involved with the criminal legal system, it's a crapshoot to say the least. But what if someone in need of treatment never went to a correctional facility in the first place? My guest today is Jack Charlier. Jack is the Executive Director at the Center for Health and Justice at Treatment Alternatives for Safe Communities, or TASC. And he's also the CEO of the Police Treatment and Community Collaborative. We love our acronyms here, so that's PTAC. Jack, welcome.
A pleasure to be here, and thank you to National Council, especially for being a great partner, personally, collegially, but also as part of PTAC, one of our 70 national partners. Thank you for having me, Phil.
Absolutely. And I wanted to point out that, Jack, you're a co-founder of the International Deflection Movement. And ever since I've known you, that's pretty much all we've talked about is deflection, and deflection.
Deflection, yes. Yeah.
I just don't want to forget about deflection.
Yeah.
But I want to start by understanding the scope of the problem. You have a sense of how many people are incarcerated and how many of those individuals have a substance use disorder?
Sure. Yeah. So in the United States, the number varies. It's around 2.2 million people are incarcerated. In other words, in a custodial setting in the United States. State prison, jail, federal prison is very small. The general number that's thrown around is about 60 to 80% have a substance use disorder. Many states report numbers higher than that. I mean, you're already at 60 to 80%, but it's around that level. So it's a substantial number of people in our custodial settings in the United States, again, jail, state prison, federal prison, that have some level of substance use disorder to the point that it has impacted their behavior, and also is probably related to very much why they are where they are right now.
Yep, and that tracks with what I hear. I'm not a professional in the deflection space, but it sort of tracks what I know about just working specifically in the substance use space.
Yeah.
How many cities or counties have a deflection or pre-arrest diversion program?
Mm-hmm. So deflection is about 10 years old. I'm going to answer this by starting with that. This year, 2025, is actually the 10-year anniversary of the introduction of the word deflection. So it was introduced in 2015 through an article through the Police Chief magazine out of the International Association of Chiefs of Police, one of our 70 partners like National Council through PTAC. And I say that to answer your question more fully, Phil, because back in 2015, we knew of a handful of deflection sites, what we would now call deflection, right? Because the word had not been introduced yet. Now in 2025, so 10 years on since the word deflection was introduced, we estimate there's about 1,600 deflection sites across the United States, which, for sake of comparison, are great partners at Crisis International, so CIT International, who do great work and have done just fantastic work in the mental health crisis space as it relates to law enforcement for going on 40 years here soon. Counts about 2,700 sites or so that are doing CIT coming on 40 years. As I said, deflection at about 10 years is about 1,600 sites. So all that is to say, Phil, the rapid growth of the field of deflection is pretty obvious.
Yep. Yeah, and that also tracks with what I'm hearing from the street. And you had me at deflection. It's still, even though it's 10 years old, it's still a what some people would consider to be a progressive approach. So what do you say when people ask, "Hey, is this practical? Can it work? Is it what about the taxpayer dollars associated with it?"
Yep. So my career, my professional career is actually focused on and has been dedicated to reducing crime, right? Reducing crime, especially at the intersection of drugs and the relationship to criminal behavior. So I'm going to answer it first from that standpoint because there is not a community in the United States that does not care about crime reduction. So from the crime reduction standpoint, Phil, the evaluations that exist already, even in a field as young as ours, already shown that there is a linkage, a decrease linkage between deflection and drug-related crime. Importantly for National Council and your audience, early evaluations and research are also showing that there is an uptake in people accessing treatment and access to treatment as a pathway to recovery. There is also, since we are continue to be in the midst of an opioid epidemic and then the fentanyl epidemic and what else is coming next on synthetic drugs, that there is a reduction in communities that do deflection of overdoses and overdose death. So kind of along the measures of crime reduction, along the measures of getting access to treatment, along the measures of helping people get well, reducing death, that's pretty good. 10 years on, we're not selling magic. This is an item in a continuum of responses. It's very, very important. As much as we talk about deflection, and you and I do, and I bring up the word often, as you already mentioned, the reality is that as part of a set of responses, it's just that prior to 10 years ago, we didn't know about this or this idea or this concept of deflection. And finally, to kind of really fully answer your question, the other thing that people care about, no matter your politics or no politics or whatever, is money. Everybody cares about money and saving money. And there's two ways in which deflection already through, again, early evaluations are showing that it is saving money. One is from police officers' time. So law enforcement is done primarily with, deflection is done primarily with law enforcement, but not exclusively, right? It can be done with EMS. It can also be done with the growing workforce called second responders. But just sticking for this conversation today, Phil, with law enforcement, we already have some early evaluations. I'm going to give a big shout out to Tucson, Arizona, that says that deflection saves money because the officer's time is reduced. The amount of time it takes to do a deflection versus the amount of time it takes to do an arrest is substantial. A deflection could be done in 15, 20 minutes. An arrest could be 1 to 4 hours, depending on what's going on. That's officers on the street that could be patrolling. That's officers on overtime. That's officers just on time not available. And then some of those costs shifts to a jail intake in the United States. The first day of jail, $6,000 to $8,000. First day, second day, right? Because that's when they're doing the intake, the mental health evaluation, the clothing, all that stuff. Every time Jack Charlier goes into jail, it's $6,000 to $8,000. Every time Jack is not going into jail, it's $6,000 to $8,000 saved. Every time Jack is not going to the emergency room, it's however much money that is saved. So we are getting early evaluations. It's saving money, reducing officer downtime, allowing officers to be on the street elsewhere. And again, the other factors of crime reduction as it relates to criminal behavior related to drug misuse and addiction, saving lives. What's more important than saving lives? There is nothing more important than that in people's well-being.
Yeah, and I didn't disclose this up front, but we're connected in that I'm also on the board of PTAC. And I think one of the things that was fascinating to me as I attended PTAC events and kind of got to understand the way that PTAC worked was the involvement of police. And coming from sort of the public health side and perhaps the substance use side, I wasn't as aware of how supportive law enforcement was of getting people the treatment that they needed. Like I was expecting maybe a little bit more friction. And a lot of the law enforcement folks I spoke to were like, yep, we need this. We need it right now. And where's some more, right?
Yeah, absolutely. So my background is in law enforcement Also, but it's been a few years, so let me just speak as you have for current officers and agents and others, sheriffs who are out there. The reality is for them, and I'll speak broadly, dealing with situations for which they're neither equipped nor trained to handle is very frustrating for them. The law enforcement community is one that is focused on problem solution, right? Problem orientation. I am called somewhere, I respond to a call, I see what's called on view, a citizen flags me down, I respond, my wiring is to go in and solve the thing. And then I go on and I go to the next thing to solve. All your listeners know this is your guys' expertise. No, you can't solve drug addiction that way. You can't solve the intergenerational nature of addiction that way, or even just drug misuse. Right? We'll forget getting to the level of addiction. And so it's very frustrating for them where there's serious criminal behavior involved. Absolutely, law enforcement goes in, does what it does, deals with that. We don't argue that point, do what you need to do, but that's not the majority of law enforcement contacts. We know the data on that, by the way, also what that looks like. So it is frustrating for them. It is exhausting for them. They see no reward out of it. Deflection says you're not alone. Deflection says you've got a deflection team with you. And don't think of team as like people hopping in a car with lights and sirens, just folks, treatment, recovery people in the community who are going to encounter the people that law enforcement is dealing with, so that law enforcement can go do its public safety stuff, and recovery organizations and treatment organizations and service organizations can go do their stuff with the folks, and police are released. That's a really, really big comfort to police. One way I say it is deflection is the partner to police, right? We are the partner. We're not doing police work. It's not our work to do. But when police encounter someone that they know, I'm not going to arrest this person, Phil. I'm not going to arrest Jack. We got to do something different here. That something different is deflection, rock and roll. Officer gets on her back in her squad car. She goes, does what she does. And the deflection entities take over and say, we got you. We got you, Jack. We're going to work with you and we're going to be here for the long run. And the cool thing about it, Phil, and I'm going to stay in this realm of law enforcement, is, if you're in law enforcement, what you see is failure. You see failure over and over and over. Deflection, because it creates a feedback loop to the officers and to the department, says, remember when you ran into Jack a month ago? Here's Jack now. Not that, a month is magic, but 6 months, 9 months. The point is they're no longer left wondering, gee, I wonder what happened. I have no idea. Nothing good's coming from my deflection work. I'm going to stop doing it. No, they can call the deflection folks, and the deflection folks call the officers and say, here's what's going on with Jack. Here's where he is. That's very rewarding for a profession that's problem solution oriented, right?
Absolutely. Absolutely. Yeah. I'm thinking of a time where I was at I worked with a recovery community organization in Minnesota, and we had folks from the sheriff's department, and this is before I didn't understand what deflection was or anything, but we had a sheriff that I don't know if he called it deflection, but one day he got tired of arresting the same gentleman, and he brought him to our RCO, our recovery community organization, and brought him to the door and said, look, I'm tired of arresting this guy. What are you doing here? And can you help him? And not every story is a success story, but this guy ended up getting his life together and running a small business there in Rochester, Minnesota. And it's just that started a series of law enforcement showing up at our place with
yes,
what they didn't want to arrest. So it was very neat to see it happen real time.
That's excellent. That's excellent. And what I'd say to add, and that's a great story, Phil. I've not heard you share that one before. Is people ask, well, why with law enforcement? Why are they involved? They're involved because law enforcement, when it comes to drug use, misuse, and addiction, unlike mental health, where you can work really hard to kind of strip out law enforcement from mental health encounters. But drug use encounters are different, and law enforcement's always going to be responding to them. It just is what it is, not because of the drug use, that varies all over, but because of the behaviors that go with it. So law enforcement's involvement in this isn't because we're trying to lead with law enforcement. It's because they have been there, they are there, and they will continue to be there. Whereas on the mental health side, the great work going on mental health crisis response, you can kind of figure out how to strip them out, but on this side, it's not as clear. So deflection can be done with EMS, with fire, with second responders, and we want that. PTAC talks about that, as you know, it's a big part of it, but law enforcement's always going to be there. So either we we do this in a collaborative way, police, treatment, and community together, or we say, well, it's not going to happen, in which case we end up we're just going right back to jail then. We end up in no different space. And I say that because of the example you gave. If you guys are not there as the recovery organization, if treatment organizations are not partnering with law enforcement or EMS, then what was before is what will continue. Nothing will change if there's no practical application on the ground.
Absolutely. Let's shift gears a little bit, and this is kind of what's going on domestically, but I happen to know a little bit about what's going on internationally. You want to talk a little bit about international deflection and what you see in other countries?
Yeah, sure. So thank you for that question, Phil, because it really represents, again, this idea of the growth of deflection. The word deflection, but more importantly, the practices. So when we look globally for a field that's 10 years old, as I said earlier, celebrating again, and I'm repeating this for a reason, our 10th year anniversary in 2025 of the introduction of the word deflection. We can look to the United Kingdom and to Ireland, and we can see what we would consider to be deflection. They tend to use phrasing like out-of-court disposals or the word diversion, although you'll see deflection coming in because of their legal structure. They're a little bit kind of farther up legally than where because of where they have to operate. But United Kingdom and Ireland, you can see the emergence of deflection. In some African countries, as you know, we have been overseas in Africa. So if you look at Kenya, if you look at Tanzania, if you look at South Africa, there was actually just in Uganda over the last weekend, a youth deflection kind of parade in the streets. So we can see some early examples developing on the African continent. In Asia, you can look at Thailand and see some work that they've done there. Vietnam, some early stage work on deflection that's going on there. And so I just lift those up as kind of quick responses. One important thing to know is that in the field of deflection, because it's a field and a movement, it's not a program, right? Deflection is a framework, not a program. Programs are important. They're boxes. You put something in, magical, mystical things happen, something comes out, and it's better. Deflection is a framework, and it's a community-based framework, which means it is able to, around a set of elements, be able to be modified. It's be able to be modified in a variety of situations. So what will deflection look like in Nairobi, Kenya, versus what will it look like in Peoria, Illinois, versus what will it look like in Dublin? It will all be different, but it will have elements that look the same, but otherwise will contextually be different. And that's important as it grows internationally. This idea of between prevention and between diversion, now we understand deflection, but how it's understood in each country and each region will be different, and we're fine with that. We're totally good with that if they're doing the uptake and the idea of why wait for an arrest, the slogan of our field of deflection, as you know.
Yep. And I specifically around some of the work that has been done in the UK and Ireland. I feel like, so developmentally, can you talk a little bit about sort of where the different regions of the world are in terms of the deflection process or understanding?
Sure. Yep. So I'll do UK and then let's do Kenya. So in UK, PTAC has PTAC UK, which is obviously the UK version of PTAC. They are building off of, as I said earlier, what they call out-of-court disposals. Jason Q, who is the PTAC lead for UK. And their approach is based on, of course, they have a different legal system than we do in the US. The idea that when an officer encounters someone, instead of going right to arrest, so it's what we would call deflection, they use a warning system. The cool thing is that warning system isn't just designed as a way to kind of document the trail of it. It's really about connecting the people to treatment at that point and giving them treatment options instead of arrest options. And so within kind of the legal framework of the UK and how they do policing and treatment through their National Health Service, at least in England, that's what you get. Is the police do have to have that intersect because of their legal system, but they're finding ways to do what we would call deflection instead of the traditional arrest processing or going to court, which should be required. Using Kenya, again, early stage as an example. Kenya, much more kind of open, looks more like the US in some ways, much more kind of open approach where the desire of the police in communities to work alongside treatment for this early stage encounters, to not even consider it from the justice standpoint, kind of more reflective of some US communities that are able to look at it that way. But they have a different legal system, so they can do that, right? The idea that, hey, an officer encounters Jack is doing something, we weren't going to arrest, I don't need to process you, what else is available to me? Oh, well, we have relationships with the local recovery organizations, and so we're going to go right to them, and might even be early stage culturally that says this is really a matter of the local community to handle, this idea of community really being the responsible party, and it's really not even a law enforcement matter. And that's even kind of a whole different understanding than we have in the US, right? So 3 different approaches of how to look at it. And I'll add one more thing on that. And you never want to generalize, so I want to be careful saying this about any country, any people everywhere. One of the things we have said is deflection has emerged in Africa. As I've said often, I really want to see what the rest of the world, especially the US, learns from how deflection unfolds in Africa. It's 52 countries, right? It's not a country, it's a continent. But how it unfolds in Africa is we think in many ways, while the countries have less resources generally than the US, right? Lower to middle income countries, they also have still a very strong network of relationships that are familial, cultural, and heritage. So maybe think of Native American populations in the US. And so the idea of principles, we'd say in English, we'd say like a restorative justice principle or a community-based principle, those are strengths, right? Those are assets. So maybe deflection, again, isn't really the police have to do anything. The police just have to say, oh, you're part of this community, elder for this community or chieftain from this community. Here's who we encountered. Here's what's going on. And they might have the kind of the strength and the support to handle that within their existing world. And that's something different in the US. And I want to see what we're going to learn from that.
Yeah, and I think that's one of the things I really appreciate about the deflection movement is the breadth of it, because there's something no matter what happens on the continent, on the African continent, or in Europe or elsewhere, there's something to be learned from all of those experiences. Something to be taken from that. So we've done the dialogue around how great deflection is. Let's talk about maybe some things that sort of natural questions that might come up, like recidivism. So not every person that receives treatment for substance use disorder is magically healed and walks away, because we know it's a chronic illness, and we know that frequently multiple interactions or interventions are needed. So what say you around recidivism and deflection?
Yeah, so addiction is a chronic relapsing disease of the brain, totally understood. I'll say a few things about it. First of all, of course, and by the way, in deflection, we adhere to the science, National Institute on Drug Abuse, and the tremendous work that NIDA has done over the years of helping all of us understand better addiction. We adhere to the science in deflection. So first, what I'd say directly to that is, when a community has a deflection initiative and it is doing this feedback loop between officers and treatment and services and harm reduction and recovery and community, those encounters, repeated encounters, we'll call them relapse. It could be other things going on, but relapse, or just person isn't kind of there yet. We can handle those repeated encounters because deflection has this communication mechanism that allows the officer to know, I ran into Jack again. This thing didn't work. No, I know to call Phil. Phil's with the deflection group. Let me call Phil because I see him at roll call every other week. Hey, Phil, I ran into Jack. What's going on? Hey, Jack's fine. He's good. Everything's cool with him. If there's a problem, let me know. Otherwise, like, he is all good. Hey, thank you, Phil. I got it. And Jack's good. So the practical way, or a practical way by which deflection is able to respond to the science of recovery and how that works for each individual, which of course is different, is to create these communication mechanisms that allow then the officer and the deflection folks to have conversations, so we don't just do it one time and go back, right? There's no science to 1, 2, 3. Those are all numbers just made up, right? There's no science to 28-day programs. There's no science to 90 days of treatment. But in deflection, that's the way that that's handled. Is we have communication loops going on, officer encounters, treatment, recovery. They're talking to each other for the benefit of the individual, so we know what's going on, and we can handle relapse. We can handle someone who is still taking however long to go through this in a way that works for everybody. The other thing is, and I'll share this, your listeners might not know this, In law enforcement, the only training I ever received in relation to drugs, which is called DRE, Drug Recognition Education. It is, what does something smell like or look like, so you can spot it on the street and testify about it in court. Through Deflection now, we have already begun the process of doing science of addiction, if you will, for police, for sheriffs, for agents. That's brand new. They encounter drugs all the time. Oddly, and they'll tell you this, they've never been trained nor equipped to even understand it. They're not being trained to be counselors, case managers, do warm handoffs. They're being trained to understand that the person that I encounter named Jack, if we have drug misuse and addiction in play, any criminal behaviors aside, and I'm not talking about the possession of drugs, that's a different thing. What I mean, the behaviors that might go with what Jack is doing, I now can understand. And by the way, for your audience, Phil, the same way 30 years ago, the tremendous work done by mental health advocates to begin to educate police that when you encounter someone with a serious mental illness and you tell them to stop and they don't, they're not actually ignoring you or refusing you or not complying. They're not understanding something possibly. That is only now beginning in the US, Phil, for law enforcement to be educated on substance use disorder, the science of addiction, the science of recovery, the science of treatment, and they eat it up. They love it. They're not going to do counseling. They're not going to do treatment. They're not asked to in Deflection. They love it because they are wondering, why is this happening when I run into certain people? They want to know. They're smart. They're capable. That's what officers are. But they've never been trained. So what do? You go to the tool you have available. What's the tool they have available? It's been arrest until Deflection. Now they have a third option, and that's called Deflection.
Yeah, and that is definitely a good development, I would say. So stigma, and we definitely have that here, and as other countries do as well. And there've been some signs of progress around stigma, specifically of late around opioid use disorder. Congress passed the MAT Act last year, which eliminated the X waiver, or it was actually a year before last. Now that we're in 2025, and FDA's made naloxone available over the counter, which, quick shout out to our over the counter naloxone guide. I assume the magic people that are producing this will put a link somewhere in the video. But long story short, we're not there yet. We have not conquered stigma here. How do you think that complicates this work?
Yeah, so it does complicate the work. So that's the first answer. It does complicate it because of perceptions of use. I'm going to give two responses to how we, the royal we, as my British colleagues say, how we respond to this in Deflection. First, though, repeat something I said earlier. For us in Deflection, we're going to follow the science. We're going to follow what NIDA tells us, what NIH tells us, and about issues around stigma and recovery and addiction. So two sides to this answer, Phil. First, a very practical one, and that's this. I am less concerned whether an individual treatment agency or individual staff member, individual officer, or community member learns to say, boy, I see someone who's doing something that I dislike, and therefore I want to take action against them. I'm less concerned about that than they understand why that's happening and act on it in a way that follows the science and allows that person to have a path to recovery. So in a very practical way, I'm not looking to change hearts, but I am looking to change mind, because heart change is a whole different thing. And that's it. But I do want to change minds, which means I want to change policy and practice of how we respond to it. So that's a very practical answer to your question, which is really more the mind part. On the heart side, all I can say is this, and I'm sticking this conversation within the law enforcement realm. Treatment's there, recovery's there, harm reduction's there, community's there, business groups are there, veterans groups are there. But I'm going to stay on the law enforcement side. The number of personal stories that law enforcement have, either from their own daily shift experiences or family members or friends, once they get the education around science of addiction for police, they will pull you aside privately, and now even so, much less privately, a little bit more openly, and say, I understand now, I get it. I still don't like what Jack's doing, and I'm still not going to be good with it, but I understand something different is going on here and that we have a different approach we can take. So in a way, Phil, I didn't answer your question. It wasn't to dodge it. I don't know the hard thing. I don't know, but the mind to policy and practice and the actual change we see on the ground, the attitude change that exists within police. And there's been some research on that. I'll give a shout out to my colleague, Jessica Reichert at the Illinois Criminal Justice Information Authority, one of the leading deflection researchers in the United States. She has done some work on attitudinal shift of officers, not to pick on officers. I'm just, staying in that realm around deflection. And when they see that it can work, when they understand the science behind it and they see that it's real, they're not left alone, the officer's not holding the bag as usual, everything doesn't fall to them, they begin to act differently and change. I don't know what they believe, but they begin to act differently. And those different actions, Phil, are my response to the stigma side of it, of give me different policy, give me different practice, put that in place, let people see it works. And at some point, other things might follow, but at least that already gets us to a different place.
Yeah, and I'm inclined to agree with you. The hard thing is that's a broad, deep ocean. And
Yes.
there are plenty of advocates doing great work out there on that. And I think like specifically at the council, even we've definitely sort of leaned toward policy, like what policy shifts can be made to make sure that people that need access to quality health care can get it, right? That's the thing. If someone doesn't like that because of stigma, I suppose I can live with that as long as the person gets the care.
Exactly. If you do the actions that go with policy that follows the science, that gets people on a pathway to recovery, I'm fine with it. I don't like whether you like Jack or not for what I did. That's neither here nor there. I'm good with that. I can barely change my own thoughts and beliefs, Bill. I am much, if I can't change myself, I'm not going to go out and try to change others. Without trying to go long, I want to bring this quick distinction up too. And again, my background's in law enforcement. I came to deflection with a kind of a series of encounters in the late 90s that I had while working the job. But the idea of stigma around drug use, that's not going to go away. I'm sorry, it's just not. It's not going to go away. And there's good reason why, right? That's why we have campaigns: don't use drugs, don't start using drugs, and if you do it, stop. The stigma around accessing treatment and the value of that and getting into recovery, that stigma, we do need to continue to make sure we work on that. So we detach the bad person, bad habits, kind of get away from that, because these two can so easily be connected, which is drug use, bad person, and therefore treatment bad, recovery not going to happen, failure. That disconnection, definitely work on the kind of the drug use side. That's a whole different argument, and we generally are not in that space or waters of that.
So obviously this is personal, and you're passionate about it. I've known that since the day I met you. Would you care to share a little bit about how you just touched on it a little bit, but how'd you get involved in this movement, and what made you decide to promote deflection over incarceration?
Yeah. So first of all, as with all things, Phil, that achieve anything, it is really lots and lots of people. And I always began, as you know, by recognizing whatever role I played, it's the role of many, many, many people who make things go. And I want to acknowledge the many players, both within PTAC, TASC, Center for Health and Justice, National Council, Chiefs of Police, National Sheriff's Association, and on and on and on, that have made this go. And that's very important, because my story is not the genesis of a field. It's just my entry into what would become this thing called deflection that sits between prevention and diversion. So as I said, I came out of state law enforcement in the late 90s, and I'm born and raised in Chicago, born and bred, as I like to say, in Chicago. I was working on the West Side, which was the 11th, 15th, and 10th District of Chicago Police. And I was just in the squad car, just taking lunch or whatever, looking down the block, just eating, make sure I'm parked in a safe place, eating lunch kind of in the district. And I remember looking at a park I'd gone by many times, been in many times. And on that park, kids were playing. It was in the afternoon. Don't remember the exact time, but kids were playing. And that's cool. That's exactly what should be happening. And there were young adults there too. Can't tell their ages exactly, but young adults. And young adults were dealing dope, right? Just call it what it is. And I was like, that's such a bummer. And then there, every so often, a car would pull up, and guys about 20 years older than them would get out, and you can see they're a part of the kind of the drug trafficking crew for the area. And having worked in the district for a long time, having grown up actually not far from there, to be honest, not far from there at all, I thought, the tools that I have available to me on the law enforcement side cannot solve that problem. And nowadays, this is common understanding. Back in the 90s, that was not. That we were in a whole different phase. And so I said to myself, who else knows about what's going on here from these other organizations that are in a community, like drug treatment, like mental health, like churches, like business groups? Because I see some of these same people moving in out of those other buildings. So my story is this light bulb going on. Again, now it's obvious. It was not in the 90s. Like, that was a whole different time, a whole different day and age, to say we got to do something different, because the tools of enforcement alone cannot handle 3 generations sitting on a playground where one generation's trying to play. The next generation is, unfortunately, some were beginning to get into the drug trade. Some, most, in fact, all of them, I am absolutely sure, did not want to be there. And then the next generation up was already well down the road. And yet they're all on the same playground, all of which is designed for the community to use, for kids to use, and for them to be healthy and well. And what a bummer, what a disappointment. And the enforcement tools alone are insufficient. And so I began to, and I give credit to the local drug treatment agencies I went into, the mental health agencies, the civic, the churches. And I said, Pastor, teach me about what you know, because I know you're seeing some of the same folks. Hey, drug treatment counselor, teach me what you know. And so that light bulb going off at a time when that was not a common light bulb, then, as I say, I only knew enough that I didn't know very much. And that began the education of Jack Charlier to understand more about the ways in which we can approach drug use, drug misuse, and drug addiction differently, which would eventually lead to the founding of co-founding, as I said, which would eventually lead to the co-founding of a field and movement called Deflection, and the co-founding of the Police Treatment and Community Collaborative.
Yeah, you were definitely ahead of your time, Jack. I remember the 90s and the relationship between drug users and law enforcement, and there was not a lot of deflection being discussed at that time.
No. And again, the credit goes to the faith leaders on the west side of Chicago, the mental health organizations, the substance use disorder treatment organizations, the recovery organizations that I met who educated me, right? The education of Jack Charlier. I, by the way, took that back then to, I got promoted eventually to district commander and then deputy chief, and we began to have regular meetings in the drug treatment agencies, and I would invite them into our offices, and we'd have meetings together. It was eye-opening. But the credit goes to the people in the community. I want to be very clear on that, because they're the ones who said, I am glad to talk to you. We've never had someone come in before, tell it, and educate you. So they deserve all the credit. I take none of it. I will also say this, that the people in the community themselves, in any community, understand this. They understand it intuitively. They know it. It's just that the resources aren't there to get at it. And Deflection says, actually, collectively, we do have more than we know individually. And as a community, you are not helpless to what's going on in that park or in that playground area.
Sure. Yeah, and I was just thinking back to your comment about maybe some of the elders in communities in Kenya or Tanzania. And I was just at an event in west side of Chicago some months ago, where faith leaders were doing front end work with folks around sharing naloxone and even having naloxone trainings in some of the churches there. So they have pivoted even from some of their previous positions around substance use and are doing the work. So
absolutely. Yeah. And many minds, again, going back to Phil, our conversation on change of hearts and minds, again, the hearts thing, I don't really get into that, but it's many hearts that have to change. We should not assume, like, I don't put this all on police. That's just the context for today. we all have things in any arena, and I know this is a cliche, obvious statement, but in this space in particular, we have our views and values on it, and they become hindrances to people getting into recovery. And that's might not even be the police are the issue. It might be the treatment agencies, right? It might be your civic organizations. Who knows? But the point is that at the end of the day, if we want to, again, going back to the slogan for our field is, why wait for an arrest? All these early encounters, well before we need to be at the emergency, we're well before we need to even think of an arrest or an ambulance run, that's deflection. Anybody who was willing to work at that space, whether it's prevention or deflection, because they kind of go like this to each other and we're good with that, that's deflection, rock and roll. We're in a brand new space, a brand new area, and that means we can get to people earlier, and that means we can get to them and be more successful.
Perfect. Jack, I want to thank you for your time. I know you're a busy man. What a lot of our listeners don't know is that we're lucky to, if you're, I don't even know if you're in the States right now. I'm thinking maybe you're in Chicago, but at any given time you might be in some other part of the world. So I appreciate your time. Is there anything that we didn't cover that you think we needed to cover?
Yeah, and thank you again, Phil. I want to give a shout out to you as our board chair for PTAC, but also the role you play in the field, and also, of course, National Council. So 3 quick things. First, more information at PTAC. Again, might be magically put on somewhere on a link, but ptaccollaborative.org, Police Treatment and Community Collaborative. Go to the website. Lots of good stuff going on there. Second, because it is the 10th year anniversary of Deflection 2025, we're going to have a 10-year party. And what better place to throw a party but New Orleans? So the first week of December, we are going to have the 10-year anniversary of Deflection. Everybody come to the International Deflection Summit. To Phil's comments, you will see and meet people from around the world, including and especially the African continent, among others, who are doing deflection. So first week of December, New Orleans, 10-year birthday party. And again, what better place to do a birthday party than in New Orleans? And finally, I won't say most importantly, but very importantly, because I always want people to have actions to do. If you are listening to this now, go find out. And it's just easiest to do with police. Go to your police department and say, are you doing deflection? Or go to the PTAC site or pop us an email and say, does my town have deflection? And if you're not doing deflection in your town, your village, your community, rural, urban, wherever it is, start deflection. And we will help you get that started and get it underway.
Perfect. Perfect. Well, that concludes this episode of Wellbeing Wednesdays, and I hope you enjoyed our discussion with Jack Charlier. Thank you and be well.